Hi, LA Progressive friends and family. This is Sharon here, and today I'm joined by a man who I've known for many years. His name is Matt Kavanaugh. It's actually Dr. Matt Kavanaugh. And Matt, I don't think that I've ever referred to you as Dr. Matt Kavanaugh. He's the director of Georgetown University's Center for Global Health and Policy and Politics. Matt has worked for many years in research and policy work where there's an intersection between law, global health, and political science. I'm going to allow Matt to expand upon his just really many years of working in global health policy, politics, and traveling around the world. So, Matt, I wanted to talk to you today because of what's happening with USAID or what has happened to USAID. I want to ask you about the impacts, and then we can go on and talk about the World Health Organization. So, Matt, welcome. Take it away.
No, thank you so much, Sharon. It's really nice to be here and to be having the opportunity to talk to the LA Progressive audience. We are in this just existential moment when it comes to foreign policy, when it comes to aid, when it comes to the international system. Are we going to have a multilateralism? Are we going to have kind of a US presence in the world that is anything other than destructive? And so we are dealing with this here in Washington day in and day out. So really, really thrilled to be here and glad to have the conversation.
So talk to us first of all, if you can. For those who aren't really familiar with USAID, I suspect that until recently, there are many people who had never really paid much attention to USAID. What is it, and how did it play a role in your career?
Absolutely. So USAID is the U.S. Agency for International Development. It's the U.S. arm of the government that focuses on funding to organizations around the world to do health, development, a wide range of different kind of focus within that, whether it's to global public health, whether it's to climate projects, whether it's to development programs for people, women in Africa that are looking at economic development, whether it is humanitarian relief when tsunamis hit around the world and the US responds. It's the US Agency for International Development that plays a really fundamental role in that. And I've worked with USAID folks for many, many years, in large part because I cut a lot of my teeth in the world of activism and policy work and social change work on HIV. And so when the AIDS movement won a major, major victory in the creation of the Global Fund to fight AIDS, tuberculosis, and malaria, and the President's Emergency Plan for AIDS Relief, which AIDS activists won under the Bush administration to ensure that people around the world had access to HIV treatment, that money goes through, in part, the United States Agency for International Development. And so, it goes from the US Congress to USAID and then out to organizations around the world that are working on fighting poverty, fighting disease. And so, I've worked with folks there, and many of the kind of programs that it funds are funding some of the most important work around the world. I mean, one of the things that I've been talking about a lot is, when Trump was sworn in on the 20th of January, in Tanzania, in Dar es Salaam, they were declaring an outbreak of Marburg. There had just been an outbreak of Ebola. These are two hemorrhagic fevers that are super deadly, very easy to spread. The Democratic Republic of Congo was facing a huge outbreak, both of Ebola and of Mpox that we've seen in the United States. Meanwhile, in all of that, there was also the HIV/AIDS pandemic that has continued to rage. In those places, funding from the United States government makes up often 20, 30, sometimes up to 50% of the funding that goes to enable these countries to be able to respond to the pandemics they're facing. And so that's what USAID is doing day in and day out. It's been kind of characterized in these just kind of character assassination ways by Elon Musk and others. But really, at its heart, this is a tiny little bit of money. It's less than 1% of the U.S. budget, and it goes to be able to do a massive amount of good around the world, which, in my mind, is exactly what the richest country in the world should be doing. And so we've become a bit meaner as a country, a bit less concerned about the world in the last just even 6 weeks as this has gotten dismantled.
Absolutely. And not only are we meaner, in some ways it seems we're stupider because these kinds of diseases can become pandemics and in some cases are still pandemics, which means we are at risk. You know, it just obviously AIDS had a big impact on my life. Lots of loss of life in my family. And I remember first hearing of the first cases, they didn't even have the term AIDS at this time. This was back in the early 1980s when some flight attendants, I don't know if they were out of Haiti or if they were from Canada, they were trying to diagnose them with this strange virus that they'd never seen before and the toll that it took globally. It is incumbent upon, like you said, the richest nation in the world to put a cap on this if we can. It seems that we should have learned it with COVID. Now, I'm going to ask you to try to get into the mind of Donald Trump and President President what is our president's name? Oh, Musk. So um, I
Co-president, I believe. Yeah.
so why do you think they're doing this?
It's a really interesting question. So, as you were saying, Sharon, that this question of like, I too remember early in the AIDS response. I remember when, people were dying of AIDS in the United States, and then there was treatment. And all of a sudden, people living in the United States and living in the UK and living in France went from having a death sentence to be able to live long and healthy lives with the HIV virus. It was a remarkable breakthrough. And yet in Africa, it didn't get there because the drugs were too expensive and the money wasn't available. And it took another decade before AIDS drugs finally got to the continent. And in that time, 12 million people died of AIDS after treatment was discovered. The programs that were created under the President's Emergency Plan for AIDS Relief, PEPFAR, and the USAID, these are programs that were life-saving. They went in and enabled countries around the world to be able to provide these HIV medicines, along with helping support fights against the pandemics that, exactly as you say, are, threatening to the health and well-being of people in the United States. The idea that we would pull back from fighting Ebola after we saw what happens when you allow an Ebola outbreak to spread in West Africa, it's because we did exactly this. We pulled back funding at the time. We didn't pay attention at the time, and we saw that turn into a pandemic, and we saw cases, actually spread around the world. So it is incredibly short-sighted. You asked kind of what's going on with Musk and Trump, and I think that's a really interesting question. I think there's two things going on. So one is I think that fundamentally they are interested in reshaping the United States government, and they are starting in the place that they see as the most vulnerable. When you think about kind of USAID, you started the interview talking about how most people don't necessarily know what USAID is. And that's right? Because the beneficiaries are in Africa, Asia, Latin America. They are people living in poverty and in marginalization around the world. And they're not people living in LA or Kansas or Washington, D.C. even, right? And so it's not a kind of well-known entity, and it's not got recipients here in the US. And so I think they see USAID as a test case for what can they do. What if they make the world less capable of responding to public health? And I think there's two reasons they're trying to do that. First off, I think they really saw the failure of the Trump administration during the COVID-19 pandemic as something that they still need to cover for, right? It just, I think it bothered Trump and it bothered so many people that there were public health folks who were actually dared to challenge the president during that pandemic. They saw that as an affront. And so you've seen the hatred that Dr. Fauci has gotten, right? Just for
Oh my,
telling the truth about science. And so
yes.
I think this administration has it out for public health in a really damaging way. And you can see this in their appointments, whether it's the HHS secretary and Robert F. Kennedy, whether it's the NIH secretary and Jay Bhattacharya, who's been really kind of the opposite of evidence-based when it comes to these things. These are people who are critics and at times kind of skeptics would be the wrong word. I think conspiracy theorists, unfortunately, is more often the right word. And who are people who have been on the fringes of public health and who've actually got it out for public health because where their kind of pet theories haven't been actually evidence-based. So I think you've got that going on where they don't see public health and they don't see internationalism as something that they actually believe in. But even beyond that, the deep worry I've got is that this is just an easy target. You can dismantle USAID, you can kind of do it. And yes, there are some of us that are challenging it in the courts, but it is very clear that they are doing things that violate the US Constitution. I have a piece in foreign policy, and it basically looks and it says, look, where in the Constitution does it give the president the authority to dismantle an agency and to not spend money that Congress appropriates? The answer is it doesn't, right? That is absolutely the remit of the US Congress. It is power that president doesn't have, but he's trying to take it. And he's hoping that if he takes it in USAID, that maybe he'll then be able to take similar power at the domestic HHS, at the Defense Department, at the Social Security Administration, and various other places. So I think that's what's going on in many ways.
Yeah, I could not find any rhyme or reason. What is their end game in doing this? But I think what you've just offered there makes sense. It's a power grab, and they're attempting to initially do this power grab. They're reaching for low-hanging fruit, where most Americans aren't even aware of USAID. Average American may not see themselves as a beneficiary of the work that is done by that from funds that come from USAID, but I would argue that we are an indirect beneficiary, especially when you consider how these pandemics so quickly become global. So definitely. So, well, oh goodness, my hat goes off to you, Matt. So how has this reduction of funding, how has it impacted your job and what you do?
I mean, it's devastating. We are looking at really a kind of reconfiguration of the global health sector writ large. I mean, our team is directly affected. We've had some funding that's been cut, but I also do really close work with organizations around the world. And so in South Africa, for example, one of the most amazing social movement groups in the world is the Treatment Action Campaign. And they have received US funding for quite a few years now to monitor the quality of health systems in South Africa. They are led by people living with HIV in South Africa. They have been part of, they kind of call themselves the union of the users of the public health sector in South Africa. They are an amazing group of folks based in kind of the townships of South Africa, led by Black folks there, and really have kind of been the voice of poor and marginalized people in South Africa who are not well served by the South African system. They have had this amazing project where they've sent community members in to monitor the quality of health services and then to feed back and hold their own government accountable for ensuring that they are arriving in good order and that they're being well served. And then also holding all these donor funds that are in South Africa, whether it's the Global Fund or the PEPFAR programs or others, to make sure that actually the money is being spent well. It's an amazing project led by this brilliant civil society organization, and it's being wiped out. It's called Rachidse, and they've had to lay off 200 people who are people living with HIV who are leading this work around the world. On the other hand, you've got all the way to Geneva, where the institutions based there, whether it's the World Health Organization or UNAIDS, are facing massive cuts because of this decision from the United States, which was taken in short order, right? Nobody's had time to prepare for this or to plan for this. And so it's the worst kind of disruption where services are being shut down. And then you've got the governments. And so, I work really closely with a bunch of different governments. I was just in Johannesburg where we were talking with the government there, but working also with colleagues in Malawi and Mozambique and across the African continent in Uganda and Tanzania. And what we're hearing is governments are just aghast because they have been paying more and more of the funding to fight AIDS, more and more of the services that are needed. But now they've just had this kind of all of a sudden massive cut where thousands of health workers have been laid off, where clinics are shut down. And so people are not getting the medicines that they need. It is the most irresponsible thing I have ever seen in my life when it comes to the behavior of a donor government that has been supporting something that I've ever seen. And people are dying. It's absolutely happening. And so it's devastating to watch that happen, let alone the kind of much more parochial question of, just people who are having their lives work interrupted. I was talking to a colleague based here in Washington who has been, working on HIV research for decades and now is seeing all of their research cut off. And so, we are going to see a situation where we're not going to have the next generation of HIV medicines, and we might not have the next generation of all sorts of medicines. It's really quite scary.
Yeah, I tell you, it's also scary when you think of, well, really, what is their end game? Are they looking at reducing the world population? Are they targeting populations? Anytime I hear that Africa or Black people are being impacted, I always feel like, uh-oh, the rest of the world's going to just let this happen.
I think that is absolutely true, and I think that is why we're seeing, seeing the attacks the way we are, and we're seeing it quite as easily moved as we're seeing it. I really, really worry. We were looking just the other day at where there's Mpox, right? And so in the United States, there was an outbreak of monkeypox, Mpox, and it was in the United States and in Europe, and mostly affected the LGBTQ community, but a variety of folks. And the world responded to that at the time. Well, right now, the place where there's Mpox, where there's children dying, where there's thousands of cases, where there's hundreds of deaths happening, it's in the Democratic Republic of Congo. And there is nobody that is riding to the rescue. There is a kind of situation where Congo is in the middle of a variety of different crises, whether it comes to war or economic crisis, and are really facing challenging straits. And the United States has decided to just make it worse. And that is horrific. You've got a situation where, I'm just I'm aghast that my government is supporting moves to target South Africa and really go after the South African government for just allowing Black folks to have access to land. And so I think this is absolutely a deepening of a kind of global racial inequality and racism when it comes to the ways in which we understand the world. And so in that way, I don't think you can unlink the attacks on global health with the attacks on racial justice that are absolutely happening at the same time. I think they are part and parcel of each other. And it's a move to a meaner world, as I was saying, a more unjust world, and a world in which, of course, the richest and the whitest are trying to kind of regain power. And I don't think that is, I don't think that's hyperbole. I think that's actually pretty explicitly what's happening.
Well, I've always admired you for your insight. I mean, even when you were just like, I mean, because I've known you, I don't know how many years now, but
It's
definitely over
been
20 years.
20 something, 25, yes, since I was
Yeah.
a bit
Yeah.
younger. Yes.
Yeah. But you have always had great insight.
Well,
And
thank you.
I appreciate that you've taken, your brilliant mind and you're using it in the way that you do to serve the public. Is there anything else that you want to talk about regarding?
I think the only other thing that would be worth mentioning, and just because I'm like sitting in it right now, is that we're kind of watching the U.S. Agency for International Development get destroyed. And it's ironic to like be sitting here and talking about it. I've become a kind of major defender very quite publicly of the agency, but I've for years been a huge critic of USAID. I think that there's kind of some real problems with the way that the U.S. does foreign policy and the ways that that ends up kind of echoing colonialism. But the way in which kind of that agency is under assault and the kind of aid structure is under assault isn't going to make things better. It's going to just make things worse. But the other piece that's really worth just watching is kind of the multilateral space. And so, the decision by the Trump administration to withdraw from the World Health Organization is, I think, a sign of huge worry about what we should expect from the next 4 years, right? And so I think, a lot of emphasis has been on kind of Ukraine and relation with European leaders and kind of what that looks like. But I think the World Health Organization withdrawal, on the one hand is just, Trump wants somebody to blame for his failures on COVID, and that's a part of what's going on. But I think it is also part and parcel of a move to really destabilize multilateralism and undermine the roots of what ensure some of the basic functioning of the international order, right? If we're not going to fund and politically support the agency that's meant to stop pandemics, I really worry about what we are going to fund and support. And so I think it's a moment for progressive forces and Democrats and people who have a vision of social justice to actually be putting forward what a progressive vision of internationalism looks like, right? And not to enable the space, because one of the things I really worry about is, I've watched kind of the Democrats move into this knee-jerk reaction to kind of say, well, don't get rid of that thing, as if it was functioning great to begin with, instead of saying, well, why is it that we're defending, random bureaucratic agencies, right? It's very few Americans are like, I want some more bureaucratic agencies. It's not a deeply powerful message. And so what we need, on the other hand, is like, what is our vision? And so on the international front, I really hope that what we might see over this period, and I'm seeing some of the kind of political leaders, start to move in this direction. I've been, been refreshed by a few of them, but not nearly as many of them, who are starting to articulate, what do we want from the world? How do we have a more multilateral world? How do we have a situation where we strengthen international institutions rather than dismantle them? That is something that I think we are at very real danger of just kind of letting happen and saying, well, that's too bad. That's a bureaucracy far away that we don't understand. And yet it's what's holding together the world and making it more just. And so anyway, I hope that we see a bit more of that. Chris Murphy's been talking about it. A few others have been talking about it. But I do think it's a thing that in progressive politics, we're not seeing nearly enough about. So I hope that your readers and others will help us start moving in that direction.
Well, Matt Kavanaugh, Dr. Kavanaugh, it's been a pleasure. It's been an enlightening experience. I look forward to continue this conversation as we watch the unfolding of whatever else is going to come out of that administration. Thank you for joining me today.
Thank you, Sharon.
Thank you for sticking around. If you like the LA Progressive content and the discussions we have here, please consider clicking the subscribe button below and also give us a thumbs up. That helps to grow our audience by feeding the algorithm, which helps to get this content in front of more eyes. Thanks for stopping by. We really appreciate your support.